Hi, this is Dr. Shemen with an update in ENT, Otolaryngology, Head and Neck Surgery. Today's topic is adult or age-related hearing loss, or presbycusis, and its relationship with dementia. Dementia, as you may know, affects approximately 50 million people worldwide and will increase to 150 million people in 2050. Currently in the United States, there's 7 million people with dementia, and the economic burden is overwhelming. Namely, it's about $800 billion worldwide. There are several causes of dementia, including age, hereditary. In other words, if your parents had it or your siblings had it, you're more at risk. Genetics, there are certain genes that predispose, but that only accounts for about 1%. Vascular factors such as heart disease. It's very important to maintain a healthy heart, and therefore you'll have a healthy brain. Finally, head injury, stroke, smoking, alcohol, and drugs. All of these can have a potentiating effect on the dementia. Now, what about age-related hearing loss or adult onset hearing loss? Again, I'm not talking about hearing loss due to other conditions such as otosclerosis or middle ear infections or cholesteatoma. I'm talking specifically about age-related hearing loss. Now, in the across the world, about 1.5 billion people have hearing loss, and it's disabling in about a third of those, namely about 500 million have a debilitating hearing loss. Adult onset hearing loss affects 2/3 of patients who are 70-year-olds and older. However, only about 20% ultimately obtain hearing aids, largely because they don't want to see the doctor or they don't want to pay the prices for the hearing aid. Now, the interesting thing is that recent data and recent investigations have shown an association between age-related hearing loss and dementia. And that may be related to the depression secondary to the hearing loss, the cognitive disorder following the hearing loss, or social isolation. People who have hearing loss don't like to go into large crowds to mix with other people because they can't hear and are embarrassed. Now, we can't alter your age, we can't alter your hereditary, in other words, your parents or family, and we can't alter your genetics. We can improve your heart. It's important to eat healthy. You also should stop smoking, excessive use of drugs or alcohol. But we can also affect hearing loss, namely early intervention with the use of hearing aids. Now, we'll get to that in a moment. The other things you can do to avoid hearing loss are to avoid excessive acoustic trauma. In other words, myself, I've gone to the gym to do spinning and have found that the volumes in the spinning class are overwhelming. So if you do go to a spinning class or exercise class where the volumes are allowed, take with earplugs in your gym bag and insert the earplugs. The other place where people typically are exposed to loud noises is going to concerts. Another factor is earbuds. If you increase the volume on an earbud, it's directly going into your ear. Better in that case to use headphones, and don't turn up the volume that loud. Finally, people who are employed in areas of high noise, such as people working with generators or working in steam rooms, should wear noise attenuators or hearing protection, namely earplugs and or headphones, in order to protect them from the noise that they're exposed to. Now, hearing aids are different than amplifiers. You can buy amplifiers for quite reasonably on the internet. However, they increase the entire spectrum of sound. In other words, they will increase all the sounds that you're hearing, including the traffic outside, the kids laughing, etc. So you want to buy a hearing aid whose whole purpose is to separate out this signal versus noise. In other words, you hear what you want to hear and eliminate the background noise. That's called signal to noise ratio. Now, you want to be able to program a hearing aid. The ones that are typically bought in an audiologist's office are programmed by the audiologist and are tailored to your specific hearing loss. The hearing aids that you can now buy over the counter, you have to be able to program them, and they do give you the ability with an iPhone or Samsung to program that hearing aid. There are several OTC hearing aids you can buy on Amazon or other sites. One is called the Lexi, L-E-X-I. Another one is Blades, B-L-A-I-D-S. Another one is T5. There's several ones that are available. But once again, you should see an otolaryngologist first to make sure you don't have any other causes for the hearing loss, namely wax, infection, or some other abnormality in the canal or the middle ear that is impeding the transmission of sound. Once that is obtained and